Good morning to our attendees. We will begin the program in 2 minutes, just waiting in for more participants to come in. Thank you. Okay, so good morning, everyone. Welcome to Stratbase ADR Institute's virtual town hall discussion on the convergence of health and environment in shaping the strategic policy agenda of the next administration. Before I formally begin the program, I would just like to remind everyone that we are live on Facebook and this webinar is being recorded. And we have a Q&A function in the bottom of your screens for any questions that you may want to put in for our speakers for today. To begin, for opening remarks, we have Professor Victor Andres Dindomanhit. He is the founder and managing director of the Stratbase Group and president of its policy think tank, Albert de la Rosario Institute. Concurrently, he is the Philippine country head of Bauer Group Asia, a leading strategic advisory firm specializing in the Asia-Pacific. He is a well-regarded strategist. He has built winning public affairs campaigns integrating message development, public relations, and the mobilization of grassroots support. So here's Professor Dindomanhit for the opening remarks.
Thank you, Clarice. And good morning to our speakers, our panelists, and also to our participants. We saw, I think, some registrations for over these 350. Hopefully, they can all participate within the next 2 hours. But we've also invited local media, and hopefully they can get a glimpse of great ideas, great discussions that we will have this morning. We all know that the past 2 years, exactly, I think it would be exactly 2 years this week since we started this pandemic, but various health and environmental challenges have continued to undermine countries and their capacity to respond to crises and emergencies. The complexity of health and environmental challenges affects both the security of states and the welfare of its people. I call that human security. This underscores the importance of fostering cooperation to address these emerging challenges with the same urgency as conventional security threats. In Stratbase, at the start of the pandemic, April 2020, we started identifying risks that we considered challenges. And it continues, we believe, to challenge the country as we go into an election, as we are in an election season, as we try to make our decisions who to vote for. In the past 2 months, I've written about 2 critical issues. One is on the need for environmental stewardship as being collective. In my Philippine Daily Inquirer commentary, I wrote about how Filipinos are no stranger to the real effect of exogenous shocks to the economy, local economy, national economy, brought about by climate change and environment-induced risk. And I even spoke of the need for a Filipino-first security strategy early in this month, numbered March 1. And hopefully that us as voters, a critical step in our choice for the next set of leaders, president, vice president, senators, down to the local levels, is identifying the key issues that have significant impact on the welfare and development of the Philippines. In StatBase since 2004, we've been proud of using data, using surveys, listening to the public. And just last October, we partnered with Social Weather Station, and we raised issues on climate change. And we got surprised with the result that a lot of Filipinos, 74%, seem to not really understand the issue of climate change. And for us, it now becomes a challenge. How do we educate? How do we push policies to help uplift the understanding of Filipinos on the risk of climate change to their lives? Even on the issues of health, we try to understand what are the biggest problems of the health system that the government should address. We've seen what our healthcare system experienced with the pandemic the past 2 years, and hopefully this becomes a learning for policymakers, for our next set of government leaders. So internally, we decided last year, why don't we come up with 16 policy papers? We call it Beyond the Crisis, a strategic agenda for the next president. And this morning, we can hear of some of the main points that can be raised or that was raised in these papers on the issue of non-traditional security threats to peace and security in the Indo-Pacific. What about health measures? A genuine people's health agenda? Or how can we accelerate resilience and climate change adaptation? That is what we need. We need the next government to understand the issues, the problems, and maybe we can offer some insights, policy initiatives, policy interventions. As I've said, we need worthy leaders that put nation first and have an all of society approach. It cannot be done by one president that we will elect, but it needs the whole of society. So we should give high priority to addressing the mounting socio-economic and health issues brought about by 2 years of COVID-19 pandemic. Of course, we have to always fight corruption. It seems to be at the core of the failures of some policies through different administrations. Again, good morning to all. Thank you for joining us. And hopefully we will have a very deep, insightful, and comprehensive discussion of key policy positions in government.
Thank you, Sir Lindo, for setting the backgrounder and setting the tone of our event for
Thank
today.
you.
So I forgot to introduce myself. My name is Clarice Zakanay. I'm the program manager for the StatBase ADRi Institute, and I will be your moderator for today's event. So to start with the first part of our program, we have the policy recommendations for the next administration. As given as a background by Sir Lindo, the StatBase ADRi Institute has produced policy recommendation publications. And for the upcoming May 2022 national elections, which draw anticipation for a new administration that will prioritize the country's health and environmental policies. Thus, our next panel of speakers and key stakeholders will share their studies and recommendations for the policy agenda of the next administration to strengthen the economy's sustainable recovery and resiliency against various health and environmental challenges. For our first speaker, presenting her paper on the non-traditional security threats to peace and security in the Indo-Pacific, we have Dr. Melly Caballero Anthony, who will present her analysis on the growing importance of non-traditional security in the region and its significance in the Philippine and foreign security policy. Unfortunately, Dr. Melly won't be able to join us live, but she has provided a pre-recorded video of her presenting her paper and her recommendations.
Good morning to all. And let me start by thanking the ADRi Institute for the invitation to join you in this conference, albeit coming online. And I hope that this presentation will help in our thinking of the kind of security challenges facing us today. Let me start by saying that we are indeed living in interesting times, and that is an understatement. Some security analysts would in fact go further to argue that we are living in dangerous times. These sentiments have been expressed by two leaders here in Indo-Pacific, from Singapore and from Australia, who wrote in Foreign Affairs in 2020, expressing grave concerns about the prospects of an armed conflict between the US and China and the possibility of a Cold War 1.5. 2 years later, who would have thought that we are now actually seeing the raw demonstration of power as we see Russia's invasion of Ukraine? While major power competition causes a lot of concern to regional and global security, I'd like to think that this is not the only thing that matters. Today, the world is facing two existential threats to humanity: climate change and the COVID-19 pandemic. The latter has already been called the crisis of a generation, as most countries, even 2 years later, continue to grapple with the continuing spread of the disease, trying to contain it, deal with its unfolding, multifaceted consequences, and struggle to lift their economies that have been so badly devastated as a result of that crisis. Climate change and pandemics are but some of the grim reminders of the kinds of security challenges we face in the 21st century. To be sure, the rapid changes in the global environment have significantly altered the nature of threats and risk defining the security landscape. There is therefore the argument that we ought, or the states ought, to seriously assess the nature of new security challenges, revisit the current approaches, and rethink the existing policies crafted to address security. We have new considerations to think about if the goal is to prepare for sudden disruptions and keep both states and societies safe and secure. So the point being that conventional security threats like territorial disputes, armed conflict, non-proliferation, and arms race are also, that aside from this, there are also so-called important non-military threats like climate change, whose impact can be equally the same, if not more severe than those from the conventional threats. Given the catastrophic impact of a threat like pandemics, the distinction between what is high and low politics is now blurred. As such, national solutions are often no longer sufficient to address these transnational threats, and dealing with these consequences would require comprehensive approaches beyond the military to encompass political security and socioeconomic approaches, and requires whole of governance approach. In the next few minutes, let me highlight these two non-traditional threats to security in the region, including the Philippines. Starting, of course, with climate change. Much has already been written about this topic. Several scientific reports and analyses have been published have already found that climate change is a threat multiplier, given the cross-cutting impacts that a change in the global temperature above 1.5 degree brings. Despite a plethora of robust scientific studies, global summits, endless conferences, one observes that the narratives of this issue are often lost in the scientific or technical details. There needs to downscale these existing studies and apply it or translate it to regional and national contexts. Well, in Southeast Asia, climate change is now receiving a lot of attention, not least because of the region's vulnerability to the risk of a changing climate. That includes, amongst others, the frequency of unprecedented heat extremes and heavy rainfall events leading to flooding and other natural disasters. Between 2000 and 2016, records show that approximately close to 400,000 lives have been lost because of natural disasters. And the economic loss had also been so staggering. We saw that in Typhoon Haiyan in the Philippines in 2013, which was considered the fastest moving and strongest typhoon ever measured since 1945, leading to over 7,000 deaths, more than 4 million people displaced, over 1 million homes destroyed, and of course, costing the Philippine economy losses of about $10 billion. It is not just the significant increase in disaster numbers that is alarming, but these disasters are also deviating from the usual patterns, affecting areas with little historical precedent of floods and cyclones. Most recently, the IPCC report in 2021, which was dubbed Code Red for Humanity, had highlighted that climate change is already happening in every region in the world. This therefore means that in ASEAN, countries like Myanmar, the Philippines, and Thailand, which are among the world's 10 most at risk of climate change, this means that climate change needs to be already part of the normal language in security planning of states, integrated in our risk assessment and the risk mitigation strategies. It is also worthwhile to note that the reason why countries like the Philippines need to put climate change in the top 3 priorities is because climate change is also a known driver of conflicts, and the government must be extremely sensitive to the risk that climate change brings to conflict settings in countries where peace is fragile. Moreover, given the impact of climate change on the country's water resources, agriculture, and coastal and marine resources, the Philippines cannot simply be complacent nor reactive to climate change. More significantly, also, the impact of climate change in agriculture is significant, and this provides food and contributes to 1/3 of the country's total employment. This, therefore, underscores the need for it to be part of its policy agenda. Turning to pandemics, the outbreak of COVID-19 has caught the global community by surprise. The recent WHO figures now places global deaths to close to 6 million. Since its outbreaks in 2020, the pandemic has upended people's lives and resulted in an economic downturn not seen since the global recession in the 1930s. The huge economic crisis led to job losses of over 80 million in the Asia-Pacific. Global poverty rose significantly with 150 more million people falling into poverty, and climate-induced crisis also impacted food security, adding 100 million more undernourished people globally. The message of the pandemic could not be clearer. Health security is fundamental to international peace and security. Therefore, for a region that is no stranger to pandemic outbreaks, we had SARS in 2003, H1N1 in 2005 and 2007, COVID-19 and its severe consequences serve as a grim reminder of the fragility of peace and security in Asia. What is critical, therefore, in thinking about health security is the capacity of national public health systems. It is revealed that uneven capacity in public health systems among ASEAN countries has played a lot in the ability of these countries to weather the crises. The list of the non-traditional security challenges are, of course, non-exhaustive. You can add to the climate change and pandemics the list of environmental degradation, food security, and the like. Given that time is limited, let me just now end by looking at possible steps forward. In dealing with the complex issues of climate change, governments should set out key policy priorities to address its multifaceted consequences. More efforts must be given to strengthen the adaptive capacity in dealing with its direct impact through enhanced disaster preparedness and response mechanisms and other relevant frameworks. For example, establishing a specialized climate security agency or even an advisor to develop targeted strategies, create synergies among relevant agencies, and engage with international funding institutions and other agencies. Second, comprehensive risk assessment and management strategies must be done regularly to inform national policies to deal with major NTS crises like natural disasters and pandemic outbreaks. This requires monitoring capacities that needs to be strengthened at the regional, national, and local levels. This also includes developing mechanisms to compile national and subnational risk profiles and capacities. Third, finance and resource mobilization strategies must be developed to address a slew of NTS challenges. Countries should be able to harness resources from its bilateral partners, international financial institutions like the ADB, AIIB, and the World Bank, as well as engage in a very important stakeholder, and that's the private sector. Funding strategies should also be streamlined to avoid duplication and waste. When we think about climate change and pandemics, we should also think about food resilient systems to ensure that food security against disruptions like pandemics and other crises. COVID-19 have long-lasting consequences, and the idea of pandemic-proofing the food security systems must be thought of at the national, regional levels in order to avoid multiple sudden disruptions caused by this type of crises. This would therefore mean increasing investments in agri-food sector through R&D and entrepreneurship, and expanded R&D also needs to develop things like climate change, climate smart and resource efficient technologies to build sustainable and resilient food systems. Fifth, in the age of pandemic, strategies on pandemic preparedness and response are critical to national and human security. This involves things like building up capacity in disease surveillance, data collection, and multi-sectoral responses in public health emergencies. It needs no reminding that more investments in building up comprehensive national systems are imperative and informed by the principles of universal health coverage. Greater efforts must also be done, and this is my last point, or second to the last point, for ASEAN countries to promote deeper cooperation in protecting the other environment, marine environment, including stopping plastic pollution, and encourage collaboration in things like the manufacturing of vaccines and therapeutics to deal with climate change, as well as R&D partnerships in developing or harnessing technologies, even artificial intelligence, to manage these NTS challenges. And last but not least, countries should actively support and participate in multilateral frameworks like ASEAN, the ASEAN +3, the East Asia Summit, and even minilaterals like the Quad, in order to put this agenda in the security considerations of states, and also to promote greater dialogue and engagement to advance cooperation and deeper understanding of these non-traditional security issues. Thank you very much, and good day to all.
So thank you, Dr. Melly, for that pre-recorded video. I would just like to highlight some points that she raised. So often overlooked are these non-traditional security threats in policies of governments, even if its impacts and effects are transnational in nature. We should also be considering the national security threats as a crisis of a generation and often regarded as an existential crisis. So new considerations should be put to thought, and new strategies must be placed in terms of policy making, as well as capacity building the people in the middle management involved in the creation of this policy agenda. Now, to delve deeper on the health side, we have Ms. Katharina Ann Berza. She is the current director of the Advocacy Public Information Research Department of the Council for Health and Development. She also leads the council's secretariat that is involved in the campaign for a free national public health system. She took her Bachelor of Arts in Social Science major in Sociology and Psychology at the University of the Philippines, and she will be presenting her paper on the Beyond Health Measures Towards a Genuine People's Health Agenda. Without further ado, here's Ms. Kat.
Thank you. Good morning. Let me just share my screen. Okay, now hold on. Okay, thank you for the introduction. Good morning, everyone. This brief discussion aims to touch how shrinking government prioritization on health furthers inequality and gaps that push the system to a breaking point long before the pandemic hit. Most importantly, the urgent need for a genuine people's health agenda that transcends health measures and presents sound policy recommendations grounded on concrete analysis and measures that are actionable for advocacy, legislation, and the next government. The onset of the COVID-19 pandemic further revealed gaping and grave weaknesses of a fragmented system with many people, the poor mostly, struggling to avail even the most basic of health services. Health financing was brought to its knees by the perennial problems of corruption, especially in PhilHealth, and the high out-of-pocket spending. Filipinos still die of preventable and curable diseases. According to the Philippine Statistics Authority in 2019, household out-of-pocket payment was the largest among the sources of health financing in the country, comprising 47.9% of the current health expenditure by healthcare financing scheme. In 2020, this was slightly reduced to 44.7% of the OOP. In perspective, the World Health Organization states that households that have out-of-pocket payments greater than 40% of the capacity to pay for healthcare falls under the definition of catastrophic health spending. Government hospitals are closing down due to a number of factors, including the lack of budget and health workforce. In 2016, from a total of 1,224 licensed hospitals throughout the country, 434 or 35.46% were government-owned and 790 or 64.54% were private. But as of December 31, 2020, despite an increase to 1,283 in the number of licensed hospitals, government hospitals were reduced to 428, while privately owned hospitals increased to 855 or 66.4%. Most of the health expenditures remain without outpatient services and medicines that the present health system does not account for, much less for preventive services. 99% of Filipinos are not able to afford their prescription medicines because these are expensive. Hospitals remain the focus instead of communities, which are the true frontliners of any disease. There is a long-standing lack of support to public health care facilities at all levels, from the barangay health stations to tertiary care hospitals. Of the country's 42,046 barangays, only 22,613 have health stations, or roughly 5 out of 10 barangays have health stations. So what is our recommendation? As expressed at the onset of this discussion, a deep and expanded rebalancing or refocusing of our healthcare system is imperative to realize a people-centered health agenda. This approach renders a three-pronged angle to put in place long-term institutional reforms. From a top-to-bottom perspective, the health responsibility is shouldered by the national government and agencies. The DOH should be strengthened by making the agency more accountable to our national healthcare system and emboldened so as to cater to the health needs of the Filipino people. From bottom to top perspective, community health centers and provincial health offices should also be strengthened and capacitated, as they are the units directly dealing with the people's health concerns. In between, the critical and facilitatory role of civil society, non-government organizations, people's organizations, the academe, and responsible private sector enterprises should be recognized and institutionalized to ensure transparency, accountability, and social inclusion in the overall healthcare system of the country. In this manner, a people-led approach to health should be achieved and all health stakeholders be considered. Only through the said approach shall we be able to effectively confront the health challenges toward a people-centered health program, namely the increasing burden of health, crisis in the health workforce, and the shrinking government role in health. Specifically, we would like to enjoin our leaders, especially the incoming administration, on these proposals. First, a people-centered national health system. The development of a free, comprehensive, and progressive national healthcare system will necessitate major shifts in policy direction and structural changes, taking into consideration resource distribution and people's participation in health-related decision-making at the national and community level. Foremost among these policies is the allocation of an adequate budget for health commensurate to the needs of Filipinos, even beyond the acceptable 5% of gross domestic product, especially during calamities. Major legislative measures will be needed to actualize the envisioned healthcare system. The primary and overriding goal must be the provision of free health services to all citizens as part of publicly funded social services, highlighting the role of government in ensuring that the right to health is attained by the people, especially the vulnerable populations, at no cost. Second, equity in health resources. Developing and strengthening the public health care in the provision of health services is the key to achieving equity and access in health. The public health system must be anchored on the community-based approach to healthcare at all levels. The priority of providing free healthcare services and medicines must be geared towards the neediest sector of the population: the impoverished, sick, aged, disabled, women, and children. The emphasis of healthcare must be on disease prevention and promotion of general health, wellness, and environmental sanitation through mobilization of the people in major mass health campaigns on health education, nutrition, immunization, and environmental sanitation. 19,433 new barangay health stations need to be operationalized and strengthened, as well as the rehabilitation of 22,613 existing barangay health stations. At the municipal level, this entails the establishment of one primary care facility within 30 people per 20,000 population size, and so on. Third, strong health workforce. To address the crisis in health workforce, there must be a clear health and resource development plan based on the health needs. This should ensure equitable distribution of health personnel, resources, and funds throughout the archipelago, prioritizing unreached and underserved areas. To ensure an adequate number of health personnel for the country's health system, the government must initiate measures to stop the brain drain of health professionals and the labor export policy. The practice of contractualization and job order employment in public facilities must be stopped and all contractual employees regularized. The rights and welfare of health workers must be protected, including to unionize. Protection of health workers is a responsibility of the state, whether in the public or private sector, including those from NGOs and people's organizations, especially those working in areas of armed conflict. Their right to serve must be upheld and respected under all circumstances. The role of traditional birth attendants and community health workers in providing community-based health services must be recognized and respected. Pharmaceutical industry. To ensure that all Filipinos have access to quality health medicines, essential medicines, a national pharmaceutical industry must be established. This includes independent health research projects that are beneficial to the Filipinos, such as herbal medicines and other traditional practices, development of vaccines, food technology, and other appropriate technologies. The DOH must adopt a system of selective parallel essential medicines that are more affordable and have gone through extensive government testing for safety and efficacy, as well as compulsory licensing that will permit the sale and manufacture of needed medicines, notwithstanding the existence of their patents. The value-added tax on all essential medicines should be removed, and local pharmaceutical manufacturer must be entitled to fiscal incentives. The government, through the Food and Drug Administration and aligned agencies, must further strengthen their regulatory mandate to facilitate access to quality, effective technologies. Lastly, beyond health measures, the International Covenant on Economic, Social, and Cultural Rights mandate that states must protect the right to health by ensuring that all persons within their jurisdiction have access to the underlying socioeconomic and political determinants of health. These include addressing factors such as foreign domination of the country's economy, landlessness, lack of jobs, low wages, lack of food security, housing, and other social services. Thus, a host of other interventions need to be undertaken for the full realization of the right to health. These include measures to provide jobs and living wages, implement genuine agrarian reform, and ensure food security, adequate shelter and housing for the urban poor, timely, adequate, and appropriate social services. There must be a strategically planned program and services to mitigate the effects of climate change. Human rights must be upheld and protected, human rights violators prosecuted, and indemnity provided to victims of human rights violations. Overall, a people's health agenda premised on the right to health can only be realized through a national, integrated, and comprehensive health system that is publicly funded, freely accessible to all citizens, and firmly based on the fundamental principles of equity, social justice, and people-centered development. Thank you.
Thank you, Ms. Kat, for the quick overview of your paper. So as we can see from the COVID pandemic, it has really exposed the Philippines' very fragile and fragmented health system. And of course, the biggest impact is on the individuals and communities who do not have the same quality access to health facilities and other services. And this is highlighted in the lack of support and prioritization seen by not only in the government policies, but also even just recognizing that health is a top priority for every individual and every family. But of course, these have compounding deep-rooted issues as well that we have to look into in order to have a more people-centered health agenda, as stated by Ms. Kat. All right. So moving on to our next speaker, who will be talking about the environment and climate change. We have Dr. Toby Munsod. She is a professor at the University of the Philippines for the School of Economics, where she also attained her PhD in economics in 2008. She specializes in regional economics, housing economics, public economics, development economics, and impact evaluation. She also served as the coordinator of the Philippine Human Development Network from 2004 to 2005 and 2009 to 2014. She will be presenting her paper on accelerating resilience and climate change adaptation, strengthening the Philippines' contribution to limit global warming and cope with its impacts. Dr. Toby.
Yeah, thanks, Clarice. I'm going to shut my video, if that's
Sure.
okay, and then I'll share screen. Thank you. Okay. Last year, we were asked to examine how the country could raise its climate ambition, defined specifically as its decarbonization efforts. By the way, this paper is by me and two others, Sarah Ahmed and Golda Hilario. Okay, so that's what we were supposed to do. However, we restated the question for ourselves because it was obvious to us that decarbonization per se, understood as reducing emissions, would not amount to much in terms of impact from either a national or global perspective, given our high vulnerability to climate change and the relatively tiny contribution we make to global warming. As one can see on the screen, the country accounts for less than half a percent of world emissions at a rate of 1/3 the global average per capita. Moreover, the message of the IPCC special reports have been clear. While the difference between warming to 1.5 degrees and 2 degrees engenders a dangerous tipping point that can change the world as we know it, limiting warming to 1.5 degrees will only prevent some of the worst case scenarios. It will not and cannot cope with climate change. It will not and cannot eliminate the urgent need to anticipate and cope with climate change impacts, which will be dire in any case, especially for countries like the Philippines. It is thus critical for the Philippines to implement measures to adapt and protect itself, which in our view can also potentially strengthen its contribution to the Paris Agreement. So in the paper we ask, what has the country done to advance climate risk resilience and climate smart development? Where is it as regards the international effort to limit global warming to 1.5 degrees and cope with impacts? How does the ambition on the international front square with efforts on our national front? We found that there was high policy clarity and convergence in the country. For instance, early on, it was made very clear, or we made it very clear, that while priorities shall be adaptation and mitigation, adaptation is the anchor strategy, meant to be translated to all levels of governance towards integrated ecosystem-based management, which shall ultimately render sectors climate resilient. At the same time, however, there is poor operational convergence. For instance, it was found in 2013 that development plans were only partially aligned with this National Climate Change Action Plan. And in fact, in our view, there was very little sense of a climate crisis in the last Philippine Development Plan, the 2017 to 2022 plan. In that plan, climate change was, well, effectively a subsector in the environment chapter, which is chapter 20, that had to compete for resources alongside other subsectors. The operational incoherence, in our view, is probably best demonstrated by the country's first nationally determined contribution under the Paris Agreement, submitted last April, which did not reflect state priorities at all, undermining efforts to build both resilience and deliver on global commitments. Just to say a little more about that, On its face, the NDC stated the country's ambition for the period 2020 to 2030 to be a projected emissions reduction and avoidance of 75%, of which 2.71 was unconditional and the rest conditional. The target reduction of 75% was deliberately set to convey high ambition, a progression from the country's submission in October 2015, which was the intended NDC. At that time, the target was 70% and all conditional. The NDC also stated that we shall endeavor to peak our emissions by 2030 and that it shall undertake adaptation measures across a number of sectors, which was unfortunately not further explained. The 75% promise was universally welcomed by civil society groups for its ambition. However, a number of issues surround that target. First, it's not clear exactly how a 75% reduction is supposed to happen. In fact, the available figures did not add up to 75. It added up actually to 11% or at best 30%. Second, it is not clear how emissions could feasibly peak in 2030. In the graph on your right, it's already 2040, and the slope of those curves are still increasing with no sense or no signal that they will decrease or even plateau. Third, it excluded forestry and land use on the basis that forestry was a negative emitter and therefore there's nothing to mitigate, which is a strange reasoning, given that their projections show that forestry would be a positive emitter by 2030. More fundamentally, it was a surprise that the inclusion or exclusion of forestry, or any subsector for that matter, would hinge on its showing in an emissions inventory per se. Both terrestrial and mangrove forests provide benefits far beyond carbon sequestration services, among others, slope protection, flood mitigation, biodiversity protection, food security, importantly. Thus, forest management is central to the country's climate change response. Finally, why is only 2.71% unconditional, which means that's the only part that's guaranteed? It begs the question of how that tiny portion squares with the high-level policy clarity and urgency on climate action. If only 2.71 is guaranteed, does that mean that the NDC programs and measures are largely extraneous to the climate resilience and adaptation requirements of the country? In which case, why are they even being proposed? All things considered, the paper proposed a resetting of our ambition, suggesting that it reconnect to adaptation and resilience and sustainable development, thus moving away from the current GHG or greenhouse gas emissions inventory-centric approach, so that both national adaptation and global mitigation goals are better served. This is not the standard decarbonization path, but one that may be more suitable to a highly vulnerable country with a relatively tiny carbon footprint per capita like the Philippines. We thought that climate actions that prioritize adaptation and the building of resilient systems are likely to do more at the margin than disparate measures to reduce emissions per se, for two reasons. First, robust community ownership of climate action, a necessary condition for any successful pursuit of climate-smart, low-carbon development, will follow more easily from dedicated investments and targeted market interventions to build local resilience. The same cannot be said for campaigns to reduce emissions. Second, prioritizing resilience can open up previously missed opportunities to significantly contribute to global efforts based on the country's comparative advantage. For instance, the biodiversity of its seas. So the first one actually speaks to what Dindo showed, right? That people are just not aware, and we really don't have community ownership at this time, and we need to build it. So more specifically, well, the necessary first steps, we suggested returning to the first principle of adaptation as the anchor strategy, pursuing mitigation as a function of adaptation with programs and measures driven by their impact on sustainable development and not by their impact on emissions reductions per se. Operationally, this would mean quantifying the operational and indicative investment requirements of the National Climate Change Action Plan, updated to at least 2040 or 2050, programming and prioritizing these investments in medium and long-term public investment programs, fully employing the climate change expenditure tagging system, and then estimating national and cross-border adaptation and mitigation co-benefits. In essence, we're saying the selection of measures for the NDC, our priorities, should not start with an accounting of GHG, of greenhouse gas emissions, but end with it, making emissions reduction a co-benefit rather than a criteria for inclusion. The paper, we provided illustrations of how regrouping towards adaptation and resilience can propel coherent strategies to address local urgent needs, while also potentially accelerating emissions reduction or avoidance as a co-benefit. For instance, in the electricity sector, organizing around meeting the unmet demand for reliable, secure, and affordable power, rather than organizing around clean energy alone per se. In the transport sector, reorganizing around to address the strong unmet demand for efficient, dignified, safe, and sustainable urban mobility, rather than organizing around the promotion of electric vehicles per se. We also discussed coastal ecosystems and their importance to human survival and the quality of life, both locally and globally, especially in the face of climate change. We argue that a deliberate shift in the nature of the country's ambition from greenhouse gas emissions reductions to the protection and restoration of these and other important ecosystems will amount to a substantial strengthening of the country's contribution to efforts under the Paris Agreement. If I have a minute or so more, I'll add these, but I can stop now.
Go on, Dr. Toby.
Okay, so just to highlight this thing about coastal blue carbon ecosystems, we are a maritime nation with marine ecosystems that comprise anywhere from 66 to 86% of our domain. 60% of the population live in coastal zones, about 10 million rely on small-scale fishing for their food. Despite this, despite their role in human survival and the quality of life, the marine economy has received scant attention by the national government. The bias of public investments has been in the agri sector, which it is a part, has always been in crops, especially or specifically rice. Thus, the degradation of coral reefs due to siltation, destructive fishing practices, overharvesting, etc., even plastic pollution, which has contributed to the decline in productivity and threatening life. The degradation of coastal ecosystems is of particular concern given their multiple roles, especially in the mitigation and adaptation of climate change. Indeed, the extent to which economies will be able to adapt to climate change will hinge critically on the sustained supply of ecosystem services from these coastal wetlands. Here we just show that mangroves, or what we call blue carbon ecosystems, can sequester carbon dioxide at rates that far surpass terrestrial forests. And therefore, BCEs are not just a critical local and national resource, but a critical global resource as well. Therefore, improving BCE management presents a strategic opportunity for the country to advance not only the well-being of local communities, but climate risk resilience at national and global levels. Placing BCE management at the center of our NDC for both adaptation and mitigation will be a far more substantial contribution to our commitments under the Paris Agreement. The strategic opportunity, by the way, can be shared by many countries in the region. This is a really good thing to do together. As it is, however, that opportunity has not been seized. In the slide, I just show the budget. Well, in the Master Development Plan for Climate Resilience and Forestry Development, only 1.3% of the total 135 billion budget projected for 13 years is allocated to mangrove protection. So that's what I mean by kinda incoherent. Okay, thank you. That's it.
Thank you, Dr. Toby. So again, I think I would like to highlight that Dr. Toby said that our high vulnerability to climate change, as in the Philippines, is very highly vulnerable to climate change despite our low emission. She also highlighted that we should refocus from achieving these emission reduction goals to creating a more anchor strategy in terms of mitigation. Of course, rethinking, of course, our view on our strengths and
The adaptation, anchor on adaptation.
adaptations, yes. We should also rethink Philippine-specific gaps and strengths. She highlighted our geographical strength being a maritime nation, and of course, its compounded effects. And I think this specific issue was raised by both Dr. Melly as well and Ms. Kat, the compounding effects on other sectors of communities and even social issues. So to move on to our second part of the program, we will be having our stakeholders express their insights to the growing discussions on the integration of national elections and of course integration of health and environmental issues in the conversation of the national elections. So they will also be reacting specifically to the papers presented by our first three speakers. And to begin with, we have Dr. Alma Salvador. She is going to share her insights on ASEAN's response to the emergence of non-traditional security threats in the region. And she will also discuss the growing importance of establishing a regional mechanism to manage these risks. Dr. Alma.
Thank you, Clarice. Good morning, everyone. Good morning, Professor Dito Manhit and our esteemed colleagues here who are members of this panel on convergence of environmental and health threats. My name is Alma Maria Salvador. I'm an associate professor of political science at the Department of Political Science of Ateneo de Manila, and I'm here to react to the policy recommendations proffered by Professor Melly Caballero Anthony. Please allow me to share my screen before everyone. So, as I said, the focus of my reaction and my discussion is on the paper of Professor Caballero Anthony, and I'd like to make my own set of recommendation in view of the purpose of or the objective of setting an agenda for the next presidential administration. I'd like first to set the context by highlighting and reiterating some of the points raised by Professor Caballero Anthony. And there are her policy recommendations is anchored on rich theoretical and conceptual propositions, but I'd only like to highlight a few that I think would directly relate to the policy recommendations that have something that specifically focused on proposals for a revisiting of our foreign and security policies. So number one is recognition of our increasing vulnerability to transnational climate change risk. So I think there's no need to look into this in great detail because we've recently just heard the presentation of Professor Toby Monsod, and basically there is a synergy in the assertions made by Professor Anthony and Professor Monsod in terms of the vulnerability of Philippine society and the Filipino people in terms of climate change related risk. I've also looked into some of the sources here, which among many other scientific sources, scientific narratives that argue of the vulnerability not only of Southeast Asian countries but Philippines among the Southeast Asian countries. For instance, the vulnerability of the Philippines in terms of fatalities and climate disasters in the last 2 decades. The Philippines is considered to be one of the world's 25 cities most vulnerable to climate-induced sea level rise. And I've also looked into the interview of the former Undersecretary General of the United Nations, Professor Noeline Hazer, who argued that in Asia is likely to be more exposed to climate hazards, 4 times more, in fact, to natural disasters than the region of Africa, for instance, and 25% more or 25 times more than our counterpart societies and countries in the regions of Europe and North America. So second point that I'd like to raise from the paper and policy recommendation of Professor Anthony is the point on the cross-cutting consequences of climate change. And this is something that largely have been reflected in our experience in the pandemic. So number one subset of this argument is that non-traditional security, not in general, and more specifically climate change, is a threat multiplier. And in the context of our experience in climate change, we realize that infectious diseases and pandemic by themselves have also presented themselves as a threat multiplier, having an impact not only on our health security and our healthcare systems, but also on issues of social protection, labor, and education. So in other words, COVID-19 is not only to be viewed as a health crisis, but it has also as a security challenge. Its effect has been exponentially transported in various other sectors that I have mentioned. Number three important point, and this will largely relate to my propositions insofar as a revisiting of our foreign and security policies, especially for the next presidential administration, is the challenge of non-traditional security optic in blurring high and low politics. So as a result of a focus on non-traditional security, the high and low politics and the traditional definition that used to divide these two realms of politics are largely being blurred. And again, we reflect on our own very experience in the pandemic, where a declaration of the emergent declaration of COVID-19 as a worldwide emergency has paved the way for domestic securitization, even regional securitization, requiring the massive infusion of financial and health resources, and in most domestic settings, the deployment of military and law enforcement personnel. And the fourth point here is the importance of anchoring our policy recommendation on the ASEAN regional security infrastructure that has evolved in the context of the institutionalization of initiatives and efforts and coordination of ASEAN member states insofar as the management and of non-traditional security over time. This slide is something that would show you some examples of how efforts are evolving and institutionalization is still ongoing, and we've seen some of these gains being reflected in the way by which we've responded as a region to COVID-19. Now, in view of the agenda setting for the next presidential administration, so having looked into the context set by the conceptual elements that I have singled out from the presentation and the policy recommendation of Professor Anthony, I'd like to make a proposition based on the following. Number one is a framing of the national security, or a reframing of the national security or of our national security policy from a perspective of human security, in which transnational climate change related risks are identified as the most challenging environmental health security risk of all time. In relation to this, there is a need to adopt a nexus approach to traditional security and non-traditional security challenges. When we say a nexus approach, we are not only looking at the interaction of the two and the integration of the two, or mainstreaming of NTS into the realm of traditional security directions, but the adoption of a more collaborative approach, the involvement of multi-stakeholders, a whole of nation, a whole of society approach in defining and implementing our security imperatives. This would also therefore require enhanced burden sharing, using the words of Professor Nantini of RSIS. The idea of a whole of society approach would therefore require a distribution of the burden and enhanced burden sharing on the part of various actors from the local, national, and regional levels, insofar as fulfilling the objectives of our security imperatives. Number two would be policy convergences to reflect the cross-cutting consequences of NTS. We have come to recognize that non-traditional security threats are threat multipliers, and therefore the challenge that is being presented to the next presidential administration is basically the theme of this forum, and that is policy convergences, especially in my own recommendation in the realms of security and foreign policies, and in the realms of environment and health sectors. So looking at the national security policy, there is and insofar as my first recommendation is concerned, anchored on a human security framing, we would like to highlight that the current national security policy provides a very state-centric national security perspective. There is a claim that the perspective that is adopted or that is used to frame the NSP of this administration is human security centered, but human security is just one of many types of security that has been mentioned in the array of security imperatives that have been listed in the national security policy. In fact, state centrism is reflected in the stark dichotomy between security threats in the internal security realm versus the security threats that govern external realm, where internal security challenges are framed in terms of security threats in the public order, armed conflict, terrorism, and transnational crimes. So it is important to note that while terrorism and transnational crimes have been mentioned as a primary consideration of the NSP of the current administration, that there is a further need to tie this together with policy emphasis on transnationality, and therefore, with that emphasis, a view that greatly links various types of security threats, traditional and non-traditional alike. And again, the threats that have been identified, external threats that have been identified in the NSP, and so in the external sector realm, are basically geopolitical in orientation. So, having laid down this primary critique of the current NSP, it is being proposed to the next president and to the next presidential administration to adopt or revisit the NSP, the security planning in terms of a nexus approach, a human security, and in relation to it, a nexus approach to the traditional security and non-traditional security challenges of the Philippines. The policy making process, as well as the security planning processes, have to take into consideration, number one, the interlinkages of our security concerns, traditional with non-traditional, but more importantly, the interlinkages of our non-traditional security threats, for instance, and as well as their transnationality. For instance, climate change, food security, water security, and communicable diseases. It should take into consideration and implement a set of strategies that will integrate the challenges that besiege internal and external security in view of the blurring of these two divides. For instance, when we say blurring of the internal and external security divides, we look at, for instance, climate change, the climate change related risk, eventually extending the issue of maritime security in the South China Sea to beyond the maritime dispute. Climate change therefore transforms the maritime security or maritime dispute in the South China Sea from a geopolitical issue alone to issues that pertain to illegal fishing, climate change induced marine degradation, coral reef bleaching, that basically underpin the competition that takes place between smaller powers and China from within the region. Now, this framing, although a very tall order, because it will involve trust from between and among various sectors from within national agencies and from within society itself, would have an impact on the use of different forms of power, including military power and law enforcement power. We also need to address the challenges of the nexus approach, which would include alignments in planning frameworks, lexicon, schedules, issues of trust and capability issues. Surprisingly, the national security strategy more or less reflects some of the elements that have been encompassed in the policy recommendations of Professor Meli Caballero. There should be a greater match. In other words, there should be a greater convergence between the NSP and the national security strategy. In the national security strategy, I'd like to look at 2 points here that may be tightened, or that should be tightened further. First, a presentation of the Philippines as an archipelago. So in the NSS, there is an argument in laying down the strategic environment that the Philippines is an archipelago. As an archipelagic state, the connotation would be the right of the archipelagic state and obligation of the archipelagic state in view of providing innocent passage, freedom of navigation, etc. But what is important is here, I echo some of the points raised in the presentation and the policy recommendations of Dr. Toby Monsod in arguing that we should present ourselves as a maritime nation. We know that we are a maritime nation, but in terms of investment and funding for our maritime security and maritime industry development largely do not reflect this emphasis insofar as this identity is concerned. In the last point, so I've mentioned 3 sets of policy recommendation. This is the third one, the last one, on convergence as a policy. So bullet point 1, we should pay greater attention to a non-traditional security approach to foreign and security policy in view of the hegemonic rivalry in China and the United States. By adopting a nexus approach between traditional and non-traditional security, we not only bank on our alignments or a questioning of our alignments or a revisiting of strategies based on hedging, but we revisit our conceptualization and our definition of our maritime security policies. An integrated approach to maritime security and the South China Sea, in which our concerns in maritime security should be translated beyond the maritime dispute. This will desecuritize the tensions that didn't seem to have gone away despite the policy of hedging and appeasement that has been implemented largely by the Duterte administration. As a small state, we need to be able to invest in capabilities that focus on practical cooperation in the areas where we reflect this nexus between traditional and non-traditional security, such as, for instance, enhanced military modernization, specifically enhancing our maritime domain awareness so that we can combat terrorism, transnational crimes, piracy, but in addition to these concerns, invest on fisheries management, curb illegal, unregulated, and undocumented, unreported fishing, address food security, consequences of climate change related risk in the maritime domain, border protection, fishery resources protection, integrated coastal resource management, marine preservation. Rather anticlimactic, but this is the way I'd like to end my presentation on the basis of the 3 policy recommendations that I propose in view of those that Professor Meli Caballero Anthony has put forward before ADRi. On that note, thank you very much. Good morning.
Thank you, Dr. Alma, for the insights for the non-traditional security threats. We'll be moving on to Ms. Girly Lorenzo. She is the president of the Philippine Alliance of Patients Organizations. She's also the co-founder and executive director of KITE Inc. and a certified child life specialist by the Child Life Council. She advocates for patients' rights and is engaged in health policy development. She is also one of the conveners of UHC Watch. Ms. Gurley.
Good morning, everyone, to all my co-panelists and the attendees. The Philippine Alliance of Patient Organizations is a coalition of patient organizations advocating for universal access to healthcare and allied services and is a member of the International Alliance of Patient Organizations. We aim to empower Filipino patients, including persons with disabilities, through education, networking, policy advocacy, and capacity building. PAPO advocates for meaningful reform in three fundamental areas in order to improve the quality of healthcare in the country. One being respect for patients' rights, two, universal healthcare, and three, patient participation in health policymaking. PAPO's advocacy is aligned with the proposed Genuine People's Health Agenda, a people's health agenda, and I quote the researchers when they said it is premised on the right to health, which can only be realized through a national, integrated, and comprehensive health system that is publicly funded, freely accessible to all citizens, and firmly based on the fundamental principles of equity, social justice, and people-centered development. My reaction on the first recommendation on People's Health Agenda. The researchers suggested a top-to-bottom perspective wherein DOH must be strengthened. We believe that DOH can only be strengthened with the choice of a right leader. The next Secretary of Health must have integrity, have very good managerial skills, and innovative enough to integrate into the health agenda programs which will address issues on hunger, environment, etc. And bold enough to shift the health system from being doctor-centric to becoming patient-centric. The recommendation also focused on the critical and facilitatory role of civil society NGOs and CSOs. The researchers said that NGOs and CSOs should be recognized and institutionalized to ensure transparency, accountability, and social inclusion in the overall healthcare system of the country. We definitely agree. We in PAPO have been advocating for the institutionalization of patient participation, especially in the LGU's local and provincial health boards. It is important for health policymakers to engage patient leaders because they have the lived experience and considered experts on specific diseases. Health programs on the ground will be successful when local chief executives and other health policymakers engage patients, a very important stakeholder. On the recommendation regarding people-centered national healthcare system, the proposal to have a free integrated healthcare is an ideal scenario. I believe, though, it will take a lot of political will to implement and sustain this. It is important to include the use of digital technology, which can contribute to an integrated people-centered national healthcare system. The use of electronic medical records will ease the patient's navigation from one health center to another, and patients' data, which includes information on cultural and family background, can assist medical teams in understanding the patient and reaching appropriate diagnosis and treatment. The use of electronic records will also lessen electronic medical records will also lessen the patient's out-of-pocket expenses for diagnostic procedure. On the recommendation for a strong health workforce described as having a clear human resource development plan based on the health needs of the Filipino people, we strongly suggest to professionalize barangay and community health workers and shield them from politics. The barangay health workers have been trained for various health programs, and professionalizing their role will ensure continuity of these health programs on the ground. On the recommendation to have a genuine pharmaceutical industry, the government must give importance to developing, compensating, and recognizing Filipino scientists and researchers. The pandemic has highlighted the importance of having experts in addressing COVID-19. It is high time government gives more incentives to Filipino scientists and researchers. The researchers also proposed beyond health measures which will include providing jobs and living wages, implement genuine agrarian reform, and ensure food security, adequate shelter, and housing for the urban poor, timely and adequate and appropriate social service, climate change and human rights must be upheld and protected, indemnity provided to victims of human rights violations. It really takes a comprehensive approach to achieve an ideal health agenda. So much depends on the type of leader we choose to become our next president. We need to scrutinize and choose the best candidate who can at least move us closer to a truly people-centered public health system. The president only has 6 years in office, and in the first 100 days, we hope the elected president will prioritize the full implementation of primary health care. Thank you.
Thank you, Ms. Gurley. We will be moving on to our last panelist. Mr. Renato Redentor Constantino is the Executive Director of the Institute for Climate and Sustainable Cities. This is a Philippine-based international non-government institution that promotes advancing fair climate policy and low-carbon, climate-resilient development. Under his leadership, the institution was able to contribute to the literary of anthology with the publishing of the award-winning book titled Agam, Filipino Narratives on Uncertainty and Climate Change. Sir Red.
Thanks, Clarice. In the interest of time, so that others can have a chance to also contribute their insights, let me jump straight into my reactions to the speakers. They've all given really vital points, but some really stand out. It made me recall what an elderly Dr. Carl Jung, the psychiatrist, wrote in his autobiography. He said, in the end, the only events in life worth telling are those when the imperishable world erupted into this transitory one. It's an interesting notion because that's a transitory world is truly what where we're at the moment. Highlighting our current context is vital, even if it's so obvious. And I thank the speakers for that. The pandemic we're in certainly won't be the last the world will face. And even more certain, we can expect more and worsening climate change impacts. The speakers have pointed out to us the problem from different angles, but let me sum up what that big picture looked like to me. The world, especially the Philippines, were in such an incredibly deep mess because for so long we've lived with the notion that the only measure of progress is productivity and GDP. How wrong that notion is. It's time we establish resilience at the center, at the heart of macroeconomic fundamentals, including its proper application in the private sector. The absence of resilience is why we're in this deep mess. it's time we establish as well ways to measure if we are indeed advancing resilience goals. This is going to be extremely challenging because of decades-long neglect. But unfortunately, but also fortunately, it is just absolutely necessary to establish these metrics if we are to expect ourselves not only to survive, but thrive in a climate-constrained future. I want to stress as well how critical it is to understand how changes in perspective matter in the long term. And now, that's a big message that our speakers have shared as well. A lot of our assumptions are standing on its head, and it's time we correct things and turn it right side up. We can't go, for instance, we can't go far if we remain on the current pathway, a pathway that we can characterize as bean counting emissions reductions. We can and must contribute, certainly, to the global fight to reduce the harm that the climate crisis poses. That is a must, undeniable. But our contributions will truly matter globally the more we prioritize the development needs of our people. Climate action strategies need to be part of a larger transition strategy focused on sustainable, inclusive, and resilient economic development. I hope that message resonated to the audience based on what the speakers have said. Overlooking this fundamental reality can be counterproductive as well, because if the public cannot identify with the development goals arising from their government's climate strategies, the political consensus we need, which is required to make increasingly difficult decisions down the road, will be even harder to achieve. Or if we realize these decisions, it will probably be hard to sustain if the people do not back the challenges and the ways that we need to respond to them. The selection of measures for climate action, that's something that also needs to be highlighted, because as one of our speakers really noted, it should not start with an accounting of greenhouse gas emissions, but end with it. That is going to be one of the outcomes, making emissions reductions a co-benefit rather than a criteria for inclusion. It seems obvious, but what we've practiced for so long is a reverse of this. That's time we turn that right side up. I also want to note the way that resilience has been posed, because it's important we understand resilience as a strategic matter, requiring a longer-term horizon that spans several planning cycles, perhaps starting with projections of at least 18 years into the future. But we need to start now. If we keep on with our short-termism, especially with the next administration, then we're not going to go very far, because the climate doesn't respect or doesn't recognize electoral cycles. We cannot plan for a crisis that is going to go on for many decades, and we are only looking at it from electoral cycles or annual objectives. Has to be far longer. We need to stop looking at climate change as an environmental problem, and it's time our fixation with disasters stop, because climate change is more than environment considerations, and certainly it shouldn't be equated with disasters alone, which is a small subset. We need to look at climate change, especially this audience, from the right perspective. I don't think it's about green. I don't even think it should be about blue. I think we need to look at it from a really pragmatic point of view. It's about trade-offs, and it's also about supply chains that should be evident to all of us, especially business, because of the difficulties that we're going through and which will remain in the near future. Looking at trade-offs and supply chains will be central to how we will grapple with and prevail over our current challenges. I think the resilience agenda is also not confined to government responses, because it should be central to private sector considerations. A race to green, a reminder, a race to green can be a distraction if it ends up as mere corporate social responsibility beauty pageants, rather than the outcome that really matters, because you will be measured ultimately by your your outcomes. Enabling the acceleration of low carbon transitions needs to add to your bottom line. That is really how many will be looking at the actions rather than displays of CSR. We also need to see that resilience actually matters really much in businesses, but also because of its impact on human resources. We need to, for instance, tackle one of the items that have remained neglected for so long, the thermal impact on labor. Health has been pretty obvious and discussed quite well in this forum. And we need to develop new metrics really that measure progress in resilience among businesses. There was a particularly important point that Professor Caballero Anthony had raised by raising conflict and climate, which is a vital link. But it's important enough also to issue a warning because the conventional approach so far seems to be to link climate and conflict, but using indicators when you see outbreaks of armed violence. This is a mistake. It's not only a distraction because it will limit what we actually can see. Encounters, armed encounters and bombings actually take place more usually as an outcome of toxic masculinity when commanders, warlords, chieftains clash. We must look instead at how local hunger and poverty incidents, pest infestation, forest fires, slow onset climate effects that Professor Monsod had outlined will have an impact on conflict in the future. It's time we pay attention as well to something that I think would have had more discussion if we had more time. And this is about how we actually deliver responsive services. Probably it's enough to mention that we need to look at how our different tiers of government will respond to our situation. And in this, I'd like to remind everyone that the province will be central to how we respond to a lot of the challenges that were posed by speakers, because it avoids a pretty wasteful, noisy discussion on charter change when we have steps that we can actually make by prioritizing the province over clumsy, centralized, cookie-cutter government programs and fragmentation by looking only at towns. The province is in the middle and is probably the most suited, but also the least resourced currently. A new administration should fix that. We need to take advantage of integrated responses. And a lot has been said on this. Let me highlight two in particular in terms of integrated responses. On transport, mobility. Active mobility creates a lot of benefits in terms of promoting health, but in actuality, it's active mobility that has been transformed because of the pandemic into ways that have made it more and more mainstream. There is a cycling revolution that's taking place, and it's not about recreational cycling, but about cycling commuters. Probably before the pandemic, the number of cycling commuters would have been 100 or a couple of hundred. Some experts have projected at least 500,000 daily cycling commuters are now on the roads. Some have said probably it's several magnitudes higher. And the more we pay attention, especially the new administration, to the prioritization of multimodal public transportation programs, especially active mobility and non-motorized transport, prioritizing pedestrians and walking, means that the co-benefits to the climate will be immense. But it depends on what we chase. Again, if we chase emissions reductions, you'll end up with a different outcome. If you prioritize the welfare of our working families, it's probably going to produce bigger climate benefits as a co-benefit. Chasing affordable, reliable, and energy secure power is another, because it's so fundamental. But as Professor Monsod had said, it makes a big difference if you chase clean energy rather than affordability, reliability, and energy security. By chasing the right goals, we actually end up realizing decarbonization aims faster, but as a co-benefit. of the prioritization of our people's needs over the pursuit of bean counting emissions reductions. We've shown repeatedly already, and when I say we, it's the organization I belong to, why currently coal is actually the most unreliable and even intermittent source of power, and how obsolete baseload thinking is what's propping up coal power, is also responsible for the continued outages in the power sector. If we fix what we actually need right now, rather than try and chase climate benefits as a priority, we will end up transforming a major source of emissions, again, by prioritizing economic and development considerations rather than, ironically, rather than climate change considerations per se. Blackouts currently are compounding suffering that's taking place during the pandemic. And as our research has shown, coal is actually behind the astronomical high electricity rates that even Meralco today acknowledges. And yet our rules continue to allow the same companies responsible for the outages to reap windfall profits. Just the other day, the GN powered Dinginan 668 megawatt supercritical new coal plant broke down again. The officials of Aboitiz said it was a minor relay concern, but it begs the question, if it was so minor, then why did the power plant trip? Also in the news, for instance, recently is the petition by private sector power generation companies that have been asking the Energy Regulatory Commission to lift the secondary price cap in the wholesale electricity spot market. The GenCos have illustrated the imminent danger because, in their words, quote, amid skyrocketing coal and oil and gas prices globally, power industry players would be incurring huge losses. They're correct. And it's an interesting notion that illustrates one of the main points. If the secondary price cap, for instance, is suspended, spot market prices will likely get higher. But the GenCos have used a really compelling argument because they're saying that the secondary price cap actually distorts the true cost and is not reflective of the real situation in the energy sector. That's correct as well, because if you suspend and get higher prices, it's easy to imagine political implications, but also it encourages everyone to look at what choices really are, and it sends a couple of pretty important signals to the market. Keeping the SPC as a tool for regulators to keep prices artificially low actually ends up diluting market signals. And this is a really important point because given the crisis we're in with the triggered especially by the Ukraine, the war on Ukraine, it has created cascading effects that have reached our shores. The principle of sending the right signals to the private sector, to the power sector in terms of what investments and where investments will really matter is quite important, but can also be harmful. Harmful because the selection has been, the application of this principle has been quite selective. The same GenCos are unfortunately silent or insist on keeping the automatic pass-through, which is actually what is distorting the market as well, since it allows them to run risk-free businesses by passing wholly volatility risks to the ratepayers. So both actually need to go. If we want to prioritize, and we should prioritize competition in the power sector to actually enable a faster transformation of our energy system, the ERC should stop compounding the problem by imposing ridiculously low penalties for those responsible for outages. Recently, they slapped a total of 15 million on companies that exceeded the outage limits. And it's actually tiny when we realize that 1 billion pesos in 2 days alone was earned by the same companies in the spot market. So clearly, ERC has a role to play in the energy transition by imposing penalties on coal plants that keep on breaking down, old and new, and by limiting their play in the spot market because they cannot be allowed to game the market by giving them full reign or free reign to operate when the outages have actually been getting worse and worse. A lot of practical steps that are at hand that do not need to be invented or do not need complex approaches. What the speakers have said is the tools we have are already in front of us, but we need to take them on, change the way that we view our current problems, and take action right away. Let me end also by saying that the elections are coming up, and we just need to avoid what has been a recurring mistake for a lot of people, which is we often think of elections as the end point, when in fact the outcome should be the starting point only. Whoever wins, we are responsible for ensuring that whatever promises there are and whatever our agenda is, we need to be participating more and more instead of just waking up when elections are at hand and then going back to sleep once it's done. Thank you.
Thank you, Sir Red. And we will move on now to a open forum that hopefully everyone can still stay for a bit. We have some questions come in from the email and chat box and the Q&A. But I just wanted to ask the speakers first in light of the national elections. We all know the Filipino resilience attitude, and seeing the impacts of typhoons coming into the Philippines and even the COVID-19 pandemic, this is especially highlighted by, of course, the government commending the Filipinos for their resilience. What do you think is the challenge to prevent the reliance on this mindset? And how do we change the perspective of the national government and, of course, the next administration on viewing these things like environmental challenges and health challenges as a more, again, existential crisis, not just for the Philippines, but for the whole world? Anyone from the panel can comment on this. Dr. Toby?
Yeah, I'm not sure what you, hold on. I think, I mean, that's a hard one. How do you make them believe that it's an existential? But let me just say this, and maybe I had a comment on Dr. Anthony's suggestions, and I honestly don't think it's an agency. Remember, she was saying, one solution is an agency. First of all, we do have one, the Climate Change Commission, which is chaired by the president, but now by DOF secretary and all that. And I do think it's more to do with getting community ownership. That's really the only way. And I think what we're suggesting precisely is, it's a iterative process. To do that, we also have to be concerned with adaptation so that they, you get a groundswell from from communities. I think that's one. The second thing, so I don't agree with an agency per se. I don't think it's ever worked, and maybe it will work in another country, but here, when you have another agency, it fragments it even more. Because then now they want their own budget and all their projects, and that's not the point. The point is to coordinate and assert leadership, right? I also, and I think that also has to do with, with the health. There was a comment on, how now we know how health resilience, health, I forget, is critical to development or something. I want to even take that further, that now I hope people see that health resilience is essential to economic resilience, right? And I think that that's the point we tried to make a couple of years ago. We wrote this paper to precisely say that economic managers have to expand their vision from just the macroeconomic indicators of what GDP, employment, inflation, etc., and so forth, right? And look at how institutions, right? Health institutions, environmental institutions, local governments play into the macroeconomy, right? So it's really short-sighted, you know, to track macroeconomic trends and say, oh wow, you know, high growth, whatever, high growth trajectory and so forth, we're the darling of the age, and then in one fell swoop, right, it all disappears. And that tells you that economic resilience is not about those indicators, right? It's about institutions, and in this case, health institutions. Why is it so important now rather than before? Because now is the first time in 100 years that we see how a physical shock affects the macroeconomy. Remember, we know how to deal with financial shocks, right? The GFC of 2009, alam natin yan, may formula na yan, eh, right? Well, not quite, but you know, but this was totally new. And the thing is, it's going to happen more often, right? And that's the interaction of ecosystems and health. I'm sure Dr. Salvador and others, you know, the pandemic, one can speculate that more will come because ecosystems are being degraded. And that's the intersection of, you know, climate change and health, in my view. Okay, so I think that if you guys are going to make an agenda, right, I urge you not to fragment it, right? I urge you to say, you know, the macroeconomy, a macroeconomic agenda rests on health institutions and climate change institutions. It is not apart from, right? So we stop separating the macroeconomy, you know, from meso and micro, right? It has this whole pandemic thing showed us that, right? Finally, Dindo, human security, just so, and I'm sure you know, right? 1994 Human Development Report. The 1994 UN Human Development Report was all about human security. Yeah.
Yes.
It was the first time it was conceptualized. I really love that. I really love that volume. Just now, 2022, they released another one on human security. So I think it's really good. You know, it's a good thing, right? If we're going towards that. The challenge is to, how do I say? The challenge is to, well, sometimes the word is human is the challenge, right? Because everyone thinks it's just not about, you know. So, but it's a really neat framework that marries human development, human security, and puts economic growth in its place, right? Because economic growth is just a means to an end, right? Just a means to an end. Okay, so that's my
Thank you, Dr.
my
Toby.
answer to your question, which really didn't answer your question. So
No, I
Great
agree.
points, great points.
Very good points. I think what lacks is we focus so much on numbers and figures that we don't see the human face involved in all these policies, and of course the issues coming out of it.
well, also, if I'm so sorry, I have to make this point, right? Also, we have to realize that it's not all about people-led thing. I understand that, okay? But there is really there is something we have to fix structurally.
Yes.
The macroeconomy, which is the disjoint between economic managers and the rest of the managers.
Yes.
You understand? So it, you know, and sometimes people-led movements will not help them because it's not articulated that way. Right? So you want to tell you know, it's like, teka, alam nyo, if you don't invest in health institutions, this is going to happen again and again. If you're not going to give money to make sure that the PDP, that climate change is not a chapter, but is the framework of the PDP, it will happen. It will happen continuously. Thank you.
Thank you, Dr. Toby. We have Ms. Kat raising her hand. would you have any insights and comments on this question or discussion?
Yes, thank you. Resilience is a very beautiful thing, no? Because it's a it's a Filipino trait. However, we must disabuse ourselves of using the term resilience on passing on the burden primarily on the individual or to families. In my point of view, it's very important to understand that resilience is built. And the question is, who holds that obligation that the people build resilience? No? Ensuring resilience rests primarily upon the state, we believe. For example, to be resilient in health, since health is a multifactorial, but to be able to ensure that the people have access to health, the state must build people's resilience by overseeing that the three obligations stated in the right to health of the United Nations is fulfilled, which is the respect, protect, and fulfill. So the main point here is that when we say resilience, we must also always think where does the obligation lie? And we believe that the obligation to make the people resilient rests upon the state. Thank you.
Do we have any other comments from the panelists on the ongoing discussion on resilience? If not, I will move forward to another question, particularly with sustainability of policies. With the national elections coming in, and every term is just 6 years. How do we ensure within those 6 years sustainability even after the next administration? Again, Dr. Toby mentioned that creation of these agencies, we have these agencies. What are the gaps that we are seeing, and what does the next administration have to focus on in order to address these gaps? For their own policy agenda. Do we have anyone from the speakers who wants to comment on that? Just the sustainability on policies. How do we sustain health policies and environmental policies, climate change, to be specific, when it comes to going past the 6-year term for the next administration? No takers? Dr. Toby.
I really don't want to. Ideally, in other jurisdictions, more mature, you vote. It's your vote that does that, right? It assumes that you have candidates that can be distinguished by their platform. Yeah. Of course, here we just don't have that, right? So I also don't know, but just to say, to be honest with you, there hasn't been much differentiation in policy anyway. You understand? I mean, but through the administrations, precisely some of the solutions are the same ones that haven't worked, and therefore that's why we're still in some holes in ADRi. It just hasn't worked, and they just continue to proceed with the same thing sometimes. So in that sense, it has been sustained at a bar that is lower than what it should be, I think. So I do hope that people just start thinking out of the box based on the evidence naman that's on hand. That's all. Thanks.
Thanks, Dr. Toby. Just to make it more health specific, just to tap on Ms. Gurley and Ms. Kat, what do you think is the role of the universal healthcare initiative that we have? I mean, this is a very monumental policy passed by the previous administration or the current administration. What do you think is another step forward to further promote universal healthcare law for the next 6 years of the next administration, and beyond that, or more immediate solutions that we have to be able to implement now using the universal healthcare?
I will go ahead.
Ms. Gurley, thank you.
Okay, hi. I think first is really to bring back the trust in PhilHealth, in our health institutions, specifically PhilHealth. A lot of hospitals have already been declaring that they will not renew, etc., etc. So I think that's the first step, that to bring back that trust in PhilHealth. And second, with regard to the, like I mentioned in my reaction, really focus on the full implementation of primary health care, on prevention and diagnosis, so that we will not burden the hospital system. Because as we saw in the pandemic, really, that the hospital system was overburdened because of all the inpatients, etc., etc. So I hope the movement will be shift really to prevention and have packages that will enable the typical one and one out to really go for checkups to prevent their disease
Yes.
from getting from advancing. Thank you.
Just on top of that, Ms. Gurley, and also Ms. Kat, if you want to chime in. We have a question from the audience regarding access to free medicines. Are there recommendations that you could provide for the government to be able to subsidize or even allow this to be feasible or allow it to be implemented? Ms. Gurley or Ms. Kat first?
Miss Kat. Let's
Sige.
go with Miss Kat.
Hi, sige po. Thank you. I believe that one of the most important factors that need to be reviewed by the next administration as a long-term solution is the establishment of a national pharmaceutical industry that will ensure availability and access to essential medicines. By developing the capacity of a government-owned pharmaceutical corporation, including vaccine production, prices and availability can be gradually addressed. While there is the Cheaper Medicines Act, much needs to be done. Even the DOH in 2019 said that the prices of essential medicines can be further reduced, and the availability of these medicines must be ensured throughout the country. Of course, considering the socioeconomic crisis, it is not surprising that even if the prices of some essential medicines do come down, the gaps are still there in terms of the patient's capacity to purchase. So, yun po. Thank you.
Thank you, Ms. Kat. Ms. Gurley, do you have any inputs for this question?
In fairness to DOH, they now have existing medicine access programs, especially for cancer. So it does exist, but like what Ms. Kat said, we need to expand the list of medicines that will be available for the patients. Thank
All
you.
right. Thank you. And just to wrap up the open forum, I have one last question for all the panelists. I think it was Sir Red who mentioned this about the first 100 days. I'm not sure, I forgot. But with the first 100 days of the new administration, for your specific sectors, so for Ms. Gurley and Ms. Kat, the health sector, Dr. Toby and Sir Red for the environment and climate change, and for for Dr. Alma Salvador, on the more multi-level and multi-stakeholder approach in addressing these issues, what do you think should be the agenda for the first 100 days for your respective sectors or for your own comments? We could start with Dr. Alma Salvador.
Well, I'd like to focus on foreign and security policy for the first 100 days of the president. Although, of course, it's the tendency of any administration is to relegate foreign policy at the very least as a secondary concern, leaving it to the efforts of our diplomats. But from a perspective of a policy convergence of foreign and security policy, I'd like to look into some of the best practices that I've encountered having co-convened the security sector initiative in our department. when you were still a student, our student Clarice. And part of the learnings is that, well, this is not to say that this is a best practice that is exclusive to the Aquino administration. Certainly not. And again, in echoing Professor Toby Monso's comment earlier, that there seems to be a continuity of maladaptive practices and that are being passed on from administration to the next. So even in the area of foreign policy, that's probably that comment particularly applies as well. But I do recall that the Philippine military during that time has made an effort to reach out to the society, creating tandems with civil societies and civil society organizations, specifically the academia, in trying to put forward the changes, including such as, for instance, a shift from internal security orientation of our Philippine military, anchoring on that. We're not saying that that's a perfect first 100 days agenda of the next president, because that seems to further dichotomize what Professor Meli Caballero earlier pointed, that what seems to the blurring of the divide between in and out in foreign security policy making. But during the time of the Philippine Army under the leadership of General Emmanuel Bautista, for instance, there were attempts at building partnership with civil society sector. So in that sense, for instance, civil society partnered with government in trying to monitor the implementation of the national government of certain agreements insofar as IHL is concerned. So what I'd like to say is for the next administration to convene the National Security Council. Some of our administrations have gone in existence without convening the NSC. So it has to be convened, and again, in highlighting how they can look into foreign policy and security policy convergences from a perspective of the existence of the severity of climate change threats and other non-traditional security threats. Elise, thank you.
Thanks, Dr.
Colleagues.
Alma. Anyone who wants to volunteer from the panel? Ms. Kat, Ms. Gurley, or Dr. Toby and Sir Red?
Hi,
Ms.
Clarice.
Gurley. Yes.
I already mentioned it in my reaction, but I will repeat that in the first 100 days, I hope the next administration will focus on the full implementation of primary health care, really strengthen our primary health care facilities, and focus on water and sanitation. So really on prevention of catastrophic diseases. Thank you.
Ms. Kat, raising your hand.
Yeah, thank you. For the first 100 days, we'd like our new leader to lobby for the to increase the budget for health talaga. Although this may not be done within the first 100 days, but if we will feel that the new leader will really seriously lobby for an increase in the budget for health, that is a good sign. And second is to create a clear health human resource plan. Unlike right now that indeed there are hirings for health workers, health professionals. However, most of these are in contractual positions. So it would really help if the government for the next 100 days to lobby for regular positions.
Yes.
Since there is a big gap in the ratio of health worker to population. And another very doable measure for the next 100 days is to make essential medicines free in public health facilities. Generally, the government could also make some steps in removing the value-added tax on essential medicines. That would really help our patients. Thank you.
Thank you, Ms. Kat. Dr. Toby and Sir Red, any additional insights or comments on the first 100 days? Yes, Dr. Toby.
Yeah, well, I don't know about 100 days, but two things I think I wish the signal would be made as soon as possible is the first, that the Philippine Development Plan really becomes a Philippine climate-aligned development plan. The last time we had this problem was the whole poverty thrust. Remember, after EDSA, Cory Aquino, and then FVR, right? It was FVR actually who moved poverty from a chapter, right, to the theme of the MTPDP. And I think that's what we need, right? You really have to frame development as within this, the climate crisis. And so it's a climate aligned development plan, and whatever that, it's cascades to all sectors, etc. The second signal, I know this is gonna sound stupid, but rather than a cabinet of 24 secretaries, my feeling is the main cabinet of the president should be the 81 governors. I think that, we're not going to, this is not going to work if we keep on thinking that it's a national, if we keep on acting like a centralized government. Climate change and everything, health, everything, especially health, oftentimes varies. The priorities vary in localities. It's one of the things that geography determines. And therefore, you really have to empower the local governments. And when I say that, I mean the provinces, not the municipalities, which I think are too small sometimes to be efficient in scale. And so I would really like to see a president who really says, that my primary mechanism will be provinces and not the departments per se. And that will put the departments in their proper place, right, in terms of support and rather than anything else. Thank you.
Thank you, Dr. Toby. Sir Red, any insights?
Very few. A lot of has been shared. I guess it's less of what to demand of the new administration than what we should be looking for. What we should be monitoring in particular. So in line, for instance, with the emphasis on the province, we'll be looking at whether the new administration will consider, will sustain the view that climate change is a sector or is an environmental issue, or is actually an opportunity to redo its long-term development plans. We should look at the horizon of the development plans, because if it only looks at the next 6 years rather than the next 6 years with a view to setting in place the long-term changes that we need, then it will show if the new administration is more interested in the sprint and getting the benefits from the sprint of the elections than what should be the focus, which is how do we get through this marathon, because the impacts are coming, but the opportunities will be present as well. Good indicators as well of changes would be in terms of mobility. Seems small, but it's big because it is one of the more visually compelling indicators of changes in strategy, also in terms of power, reflecting the kind of decentralization that should be powering changes in our development plans. Once we favor flexible distributed generation, it means also that centralized government is something that will be recognized as a problem, and how we empower and enable the local actors will be one of our main indicators. If our lobby is still trained at what centralized government should be doing, I think that's a mistake, because our lens will be just as wrong as the lens of government, and we don't serve the long-term purpose as well. Thank you.
Thank you, Sir Red, and thank you to all our panelists for participating and for your very, very good insights regarding these topics. We will be moving now to the closing remarks. We have Sir Paco Pangalangan, our Executive Director in Stratbase ADRi Institute, to formally close the event.
ADRi President, Professor Dindo Manhit, our speakers, and special study authors, Dr. Meli Caballero Anthony, Ms. Kat Barza, and Dr. Toby Monsod, our panelists, Dr. Alma Salvador, Ms. Gurley Lorenzo, and Mr. Red Constantino, and of course our moderator, Clarice Lacanay. I would like to begin by thanking you all for sharing your time and your expertise with us today, and for making this virtual town hall discussion the success that it is. Today's discussion on the convergence of health and environment in shaping the strategic policy agenda of the next administration is an important discussion, since it tackles what Dr. Anthony described earlier, and as Daki would reference to on occasion, as the two greatest existential threats of our generation, those being climate change and public health. These two converging challenges are not only great, but need urgent addressing as well. I think the peer-reviewed medical journal, The Lancet, captured this convergence and urgency best when they said that climate change is the biggest global health threat of the 21st century. The impacts will be felt all around the world, and not just in some distant future, but in our lifetimes and those of our children. And they said this back in 2009, more than a full decade before the COVID-19 pandemic that we face today. As we've seen for ourselves, now that the pandemic is here, that COVID-19 has exposed the gaps in our public health system. It has also exposed how public health challenges bleed across and cause social and economic disruption. And the Philippines is one of the worst affected. Our economy continues to suffer. Mobility continues to be restricted. In terms of the environment, we've heard that the Philippines is one of the most highly vulnerable countries to climate change and extreme weather events. But we are by no means alone. According to a recent UN IPCC report, as sea levels continue to rise, temperatures shift, and extreme weather becomes more frequent, almost half of the world's population is now highly vulnerable to the impacts of climate change. Increasing heat and extreme weather are changing the distribution of plants and animals across the globe, ultimately affecting food webs. Changes in temperature, rainfall, and extreme weather have also increased the frequency and spread of disease in wildlife, agriculture, and in people. In cities where most of us live, most of us that are here in this webinar today, people face higher risks of reduced air quality, heat stress, lack of water, and food shortages because caused by climate change, impact on supply chains, transport networks, and other critical infrastructure. Worse, the negative impacts of these are expected to intensify as the globe warms. Indeed, the recent public health and climate challenges and predictions are dire, but as highlighted by our speakers today, there are things that we can still do. As we all know, the 2022 elections is just around the corner. 2022 is an election year here in the Philippines, and we'll soon be welcoming the next administration with its own policy agenda, or for some, a lack thereof. Nevertheless, this new political cycle also allows us to put forward policy recommendations that could possibly address the climate and public health challenges that we are currently facing. For instance, Dr. Anthony set out key policy priorities and called for regular comprehensive risk assessment and management strategies in dealing with these equally dangerous non-traditional risks of climate and public health. Meanwhile, Ms. Kat argued that health measures should be anchored on a people-centered health agenda, that the role of communities and civil society groups in policy discussions must be institutionalized. Dr. Toby Monsod highlighted that the Philippines, like many other vulnerable countries, are likely to do more for the global effort to reduce the extent of climate change and cope with its impacts if we build robust community ownership for climate action and leverage opportunities based on our own comparative advantages. In the Philippines case, Dr. Monsod says that this is marine biodiversity and coastal resources. The policy recommendations shared today hint that there is still a glimmer of hope for us. However, for both health and climate, this means that minor reactive or incremental changes just won't cut it. Instead, urgent, more ambitious, and accelerated action is needed. Frankly, a similar thing can be said about our politics. Urgent action is also needed to ensure capable policymakers who are responsive to public health and climate adaptation challenges are elected to office. Today's discussion has made it abundantly clear that the situation may be dire, but there are things we can do and policies that we can push to change things. The trouble is that we think we have time, but we don't. And I would like again to thank our speakers and our participants for joining us today for this important discussion on the convergence of health and environment in shaping the strategic policy agenda for the next administration. Thank you and have a great day.
Thank you, everyone.
Thank you, everyone.
Thank you so much.